Although it is rare for an infant below 1 year old to suffer from cardiac arrest, it is important to treat early signs of respiratory and circulatory failure to prevent cardiac arrest. If you notice your baby is not breathing normally or is unconscious, do not panic. Just remember DRS, A, B, C. D. D is for danger. Check for danger before approaching the casualty, making sure that the environment is safe. R is for response. Tickle the infant to check for any response. S is for shout. Shout for help. Ask someone to call ambulance 995. But if you're alone, call 995 and follow the dispatcher's instruction. A is for AED. Ask someone to get an AED. The My Responder app helps you to locate the nearest publicly accessible AED from your location. B is for breathing. Look at the rise and fall of the chest to check for any breathing. This should not take more than 10 seconds. For healthcare personnel, check for brachial pulse and breathing. C is for compression. Start chest compression if the infant is not breathing normally, has abnormal breathing, or if you are in doubt. Use your index finger to draw an imaginary line. Place your middle finger and ring finger next to your index finger in an upright position. Lift your index finger, but maintain the middle finger and the ring finger on the sternum. Prepare for 30 chest compressions.
1 and 2 and 3 and 4 and 5 and 1 and 2 and 3 and 4 and 10.
Ensure that you compress about 100 to 120 times per minute. Each compression about 3 to 4 centimeters deep. After 30 compressions, perform 2 mouth-to-mouth and nose ventilation. Perform a gentle head tilt chin lift. Do not hyperextend. Place your mouth over the infant's mouth and nose and give 2 small breaths, just enough for the chest to rise. If the chest does not rise after the first ventilation, reposition the head and reattempt to ventilate. Continue chest compression if second ventilation fails. If the casualty is still not breathing, continue chest compression until AED or paramedics arrive. For infants below 1 year old, it is recommended to use a pediatric pad with the AED. Apply one AED pad on the chest and the other on the back between the shoulder blades. If no shock is advised from the AED, continue a cycle of 30 chest compressions with 2 mouth-to-mouth and nose ventilations until paramedics arrive. If the casualty resumes breathing, carry or place him in a lateral position and wait for paramedics to arrive. Remember, immediate application of CPR and AED can raise survival rates as high as 60%. You have the power to save a life.